Hi, it's Mary, a traditional Chinese medicine tutor and an acupuncturist in Canada.
Today's video will discuss treatment determination based on syndrome differentiation. We will discuss the following. 1. Concepts of disease, signs and symptom, syndrome and syndrome differentiation. 2. Treatment determination is based on syndrome differentiation. 3. Relationships of disease and syndrome, including different treatment methods for the same disease and same treatment method for different diseases.
In real life, patients often ask whether TCM can treat this or that disease. When facing this inquiry, the TCM approach will focus on the chief complaint and accompanying signs and symptoms. TCM diagnosis and treatment are not based on the disease name, but on the syndrome, which is the root of the problem.
The treatment determination based on syndrome differentiation. This is a big concept. We will have to find out the root problem to make our syndrome differentiation.
Concepts of disease, signs and symptom, syndrome and syndrome differentiation.
Disease means a complete morbid process, including specific cause, mode of onset, typical clinical presentation, development law, and outcome. For example, we have many disease names: common cold, dysentery, malaria, stroke, etc. Those are the disease. You're looking at this, disease happens, or the onset of the disease is because it's away from the balance. If our body is in balance, no matter it's a yin-yang balance, or the zang organs coordinate very well, that's called the healthy state. If anything go wrong, this is called the disease. For a disease, it's kind of like a Broadway show. It's a process. They always have an onset, the beginning, and then there's a development stage. And then the later stage or ending stage can be very long, can be short. Sometimes we got cough or cold. We can recover in 1 day or 2 days. But sometimes the disease is so long. End of our people's life, they are struggling with those kind of a disease. When we're talking about disease, we were talking about the cause. What caused it? We care about this. The onset, the beginning stage. In each stage, the beginning stage, middle stage, late stage. In different stage, what's their manifestations? We care about the stage of the disease and their related manifestations. In different stage, the treatment could be very different. There's a list of TCM conditions. Those conditions, if you look at them, you will find out that it's quite broad definition about the disease. For example, abdominal pain. We just say 腹痛, abdominal pain. Inside, there are so many organs in your belly, in your abdomen. The disease is called the abdominal pain. Abdominal mass, atrophy, flaccidity, bleeding disorders. That's the TCM conditions. The way of make this definition so broad has meaning because our treatment is not by the disease name. Our treatment is based on the root of the disease. That's why there's no need to make the disease so specific. It's not the TCM way of treating disease. Another concept is called signs and symptoms. Symptoms usually refers to the patient's subjective feelings, like a headache. Your headache and my headache can be totally different. What kind of headache?
Dull pain, sharp pain, empty pain, and what are the accompanying symptoms?
That's the personal description about the discomfort. Tinnitus, the noise in the ear, how noisy it is. Abdominal distension, not totally. Sometimes it's personal feeling, you feel the distension. Of course, sometimes when the distension reach certain stage, by palpation, you can feel it. Like the stomach becomes like a balloon, very hard to squeeze it. That one can be detected by palpation. But sometimes the examiners cannot feel anything, but the patient, they can feel that. Those are subjective feelings. There's another manifestations, we call it signs. Signs are the
Abnormal
conditions found through examination. For example, you look at the people's complexion. The normal complexion is supposed to be reddish, light reddish inside, but their skin belongs to lung. The red is something kind of like you have a white screen, but inside is the red. It's not exposed, when you observe people has a fever, the red is so obvious. But healthy people, you still have the redness. That redness is hidden as though behind a veil. If people have a shallow complexion, when you see people become sick, the complexions, you can see it. You know there's a problem. Can be the lack of the blood, lack of the qi. You can hear people wheezing, panting. There's lung-related problem. That's the sound you can actually hear. The tongue, you can see it, the red tongue or very dry tongue. You can see the teeth marks. Those are the signs more objective. On the objective side, the pulse, you can feel it. Those are the difference between symptoms and signs. Even people just use symptoms or just use the word signs, it still includes everything. It's like a simplified or short abbreviation for sign and symptoms. Another name called syndrome. This is a particular term only used in TCM, in traditional Chinese medicine. This one is pathological summary. After patient come in and you examine this patient, and then you're going to make your diagnosis. The diagnosis is what syndrome this patient have. This syndrome is a summary of the location of the disease, the cause of the disease, the nature and the progress of the disease, the stage of the disease, and also the syndrome is about the conclusion of the present pathological nature. We focus on present. As we said, any disease, they have different stage, beginning stage, middle stage, late stage. Different stages will have different manifestations, will involve different organs. So your diagnosis about the syndrome, about the root of the problem would be very different. For example, the syndrome can be heart yin deficiency. If people has a heart yin diseases, they will have a palpitations, has a very bad sleep problems. If they have the yin deficiency, yin in our body substance, we know there's a 4 body substance. One is the qi, another is the essence, and then blood and body fluid. That's the 4 body substances. Among these 4, qi is the yang, is the invisible thing. It pushes all the 3 liquids to move. So this yang is qi. The yin refers to the body fluid, blood, and essence. If the yin is insufficient, if the body does not have enough yin, if that is the case, it will have manifestations associated with that. For example, hot sensations, the feeling hot. Because the yin is not sufficient, it's not really very hot. It's the yin not enough. The balance is like this. When the yin is not enough, it relatively makes yang looks a lot. With a lot of yang, looks like a lot of yang, there will be deficient heat. Sometimes people say empty heat. That's just the same translation. This deficient heat, these people will feel hot sensations, sweating on the face, feel the palms very hot, the bottom of the foot very hot. And look at the tongue. The tongue is red and the coating
becomes less or even
disappeared, very shiny without coating. That's the typical symptoms of yin deficiency, plus the heart problem, palpitation or severe palpitations. The diagnosis or the syndrome, we call it heart yin deficiency. That's the syndrome. The syndrome is heart yin deficiency syndrome. With the same idea, there's many different kinds of syndromes. For example, spleen kidney yang deficiency syndrome, restraint of wind cold in the lung syndrome. Idea is it gives you the root of the disease. Even though there's so many manifestations, like the example, heart yin deficiency, so many manifestations, but the root is the heart yin deficiency. If it's yin deficiency, we're going to tonify the yin. You're going to use medications to treat the heart. Bitter taste medicines will go to the heart. But acupuncturists are going to select points, can treat the heart-related problems, and also you're going to solve the heart yin deficiency. Choose those points you can tonify the heart yin, like Sanyin-Jiao, SP6, can tonify the yin. That's the idea of it. You need to know the syndrome. With syndrome, we can have a treatment plan. Without syndrome, if you cannot find out the syndrome via your diagnosis, you're not going to do any treatment. Because Chinese medicine treatment is based on syndrome. differentiation. In the syndrome, we will be talking about the cause of the disease, like what caused it. It's the yin deficiency, blood not enough, or stagnant blood, stagnant fluid. We will talk about the location of the disease. It's external disease or it's an internal disease. If an internal disease, which organs involved will all reflected in the syndrome differentiation. The nature of the disease, it's a cold or heat. Cold associated with yin. Your body is cold. That's cold disease. You touch the belly, the lower abdomen is cold. The food is cold. That's, of course, is a cold syndrome. And heat syndrome, the body is burning, or it's a deficient heat, or it's excess heat. Then the situation of the disease, the mild, severe, or chronic, or acute disease. And then the relationships between the pathogenic and the vital. So-called the vital qi is called the healthy qi. Pathogenic qi is the pathogen. Onset of the disease is because the pathogen dominates the healthy qi. Depending on how strong of the healthy qi, or we call it the vital qi, we decide it's a deficient syndrome or excess syndrome. If people is healthy, the healthy qi can fight against the pathogen. In that situations, there's a lot of intense reaction of the body. You will see like young people got cold, they will have body sore, they will have aversion to cold and have fever, has those kind of symptoms. In that situation, we call this syndrome excess syndrome. Excess syndrome associated with the vital qi is very strong. Another situation
such as
pitting edema, blood stasis, the lump mass, those are also called excess because the pathogens can be seen by your eyes. That's another type of pathogen. Deficiency usually associated with the weak healthy qi. When there's a weak healthy qi, the manifestations would be very different. By compare the pathogen and the vital qi, we can decide the disease is a deficient disease or excess disease. Syndrome differentiation associated with the stage of the disease. Bear this in mind. The disease is changing. Each time a patient came to see you, you need to do the syndrome differentiation. At the current stage, what's the symptom? And you treat from there. Maybe after a week, these people get a new disease, like he's already weak. At the beginning, the patient cannot control the urine, but now he not just cannot control the urine, but he feels cold, the lower back cold pain.
the syndrome changed from kidney qi deficiency to kidney yang deficiency.
The syndromes are different, then your treatment would be different. Each time you see the patient, either that's the same syndrome or the syndrome has been developed in good way or in bad way. You will adjust your treatment method, treatment principle according to the specific situation. This is the 8 principles syndrome differentiation. Via the syndrome differentiation, we find out that the exterior disease or interior disease, the nature of the disease is cold or heat, or it's a deficient or excess, and it's a yin syndrome or yang syndrome, the yin deficiency or yang deficiency. The concept of syndrome differentiation is an approach to comprehensively analyze the data collected from the 4 examination methods and decide the syndrome based on the theory of TCM. The 4 examination method is the traditional way of Chinese medicine method of collecting data. One is by looking at the patient, like you're looking at the patient. You can see the face is overly red or it's shallow, eyes is shiny or not. The movement is flexible or not. By looking at the patient, many information can be gathered. By smelling, like people have diabetics,
They will smell like an apple.
sweet apple. If people has kidney-related problems, you may smell the urines. By hearing, when you are healthy, your sound has a voice. It's forceful. But when people are weak, the talk
Would be weak.
very different. The energies are different. By hearing, you can feel the difference. Asking questions obviously is the most direct way of getting information. Like here, you treating female patient, you are asking menstruation, menopause, those kind of informations gives you very good idea about how your 脏腑 organ works. and then examination, including taking pulse. Taking pulse is one of the methods of palpating, but more than that, we have other ways of palpating, like palpating the back-su point, palpating the channels to find out which channel has been blocked. Those are all belong to the palpation method. Those methods together, you use the 4 examination method, you gather a lot of data, and you analyze this data, use the TCM theory to analyze data, then you find out the syndrome. This process is called the syndrome differentiation. Syndrome is the root of the problem, and the syndrome differentiation is the way of analyzing, differentiate, and recognize what is the syndrome of the disease.
Treatment determination is based on syndrome differentiation.
Treatment determination is another word using in traditional Chinese medicine. Treatment determination is to consider and formulate the corresponding therapeutic principles and the method according to the result of the syndrome differentiation. In other words, you decide your treatment by syndrome differentiation. Syndrome differentiation is the prerequisite and the basis for determining the treatment. You need to do syndrome differentiation first, then you can do treatment. And the treatment is the way, means, and the method for treating disease. That's how the definition tells you. But another one people sometimes forget is treatment determination is a check for whether the conclusion from the syndrome differentiation is correct or not. By the treatment result, we will know our syndrome differentiation is correct or not. It's easy. After your treatment, patients become better. Their situation improved. It means that you're on the right track. So you move on, continue with this track. But after the treatment, your patient didn't go anywhere. There's no improvement. It means that your treatment is wrong. Or even worse, maybe you use the wrong medications. This is the thing you can directly know. For us, we will say, assume this logic or the theory is correct. We apply this theory to the practice, and the result will tell you whether you got it correct or not. If you got it correct, your patient would improve in their condition, otherwise would not. So that's why each time when patient come back, we need to communicate with patient, educate the patient to just speak out of the truth, only truth, better or not better. It helps us to decide whether continue with the treatment or we have to change our diagnosis.
Relationships of disease and syndrome.
There's 2 concepts. One is different treatments for the same disease. Disease is the same, but the treatment methods are very different. Like people has a stomach pain or stomach disease. Stomach pain can be caused by so many different reasons. Depending on the etiology and the pathomechanism, the syndrome can be different. The treatment method will be different. Another concept is the same treatment for different diseases. Even though the disease can be different, you name it, very different diseases. However, if the root is the same, then the treatment method would be the same. That's the 2 ideas goes with traditional Chinese medicine. First one, different treatment for the same disease.
Even though the conditions have the same name, such as
stomach pain, the cause is different, then your treatment method would not be the same. Here example about cold, common cold. The common cold can be caused by the wind cold, like in winter, you didn't wear properly. The coldness would attack the external part of the body. If that's the problem triggered by wind cold, the treatment principle would be eliminate the wind, disperse the cold, to open or relieve the exterior, disperse the lung, because the lung associated with the qi. You will use acrid agents or herbs to solve this kind of problem. However, even though we say cold, common cold, there's another type, it's caused by heat pathogen. If it's caused by heat pathogen, you use the same method to treat the common cold caused by cold. We're not going to solve any problems. If it's cold, you use one. it's already heat, you still use warm. It just makes things worse. With people affected by the warm heat, like summer heat, people have symptoms of high fever, sweating, but the sweating cannot reduce the heat because the heat consumes the qi. People feel tiredness. If this common cold is caused by heat, the heat consumes body fluid. You are going to use the aromatic agents to solve the dampness. This one actually easy to differentiate. For example, people got cold, usually they have runny nose. By looking at the runny nose, you know it's cold or heat. If it's caused by cold, the runny nose would be clear, the clear runny nose. The amount may be a lot because cold is yin. If it's caused by the heat, the runny nose would be very thick. And also people feel dry of the nose. Even you call it common cold, but because it's caused by different etiology, so the syndrome is different and the treatment is different. Another example is a good one. It's about the measles. You are not going to use same medications to treat measles. That's against the traditional Chinese medicine concept. Because for measles, there's different stage. At the beginning stage, it has rashes externally like this ones. The treatment at this moment is to relieve the exterior because the exterior was closed. You want to open the sweating pore to promote the eruption. You want to let those evils out of the body instead of let it like disappear. You let it go. There's an animal, a bear inside your house. You want to let it go. You let it go, that's your choice. You don't want a shutter door closed and then fight inside. That's more damage to it. So the first stage, at beginning stage, you will release the exterior to promote the eruption. That's the treatment principle. But at the middle stage, usually at the middle stage, there will be accumulation of intense heat in the lung because the heat damages the lung. The lung in and out breathe, need moisture. We don't want the lung to be dry. When there's a heat accumulated in the lung, heat damages the body fluid. That's common sense. You boil water on your stove. With the heat, the water becomes less and less and less. If there's heat accumulate inside the lung, what you'll see is the less moisture. In that situation, your treatment goal or principle is to clear the heat from the lung. That's the treatment principle. That's for the middle stage. And in the late stage, there's a residue heat with injury of yin of the lung and the stomach. At that moment, what you do, focus on nourish the yin and clear the heat. Do this thing together. At the late stage, because of the heat, damages the body fluid, especially in that situation, the lung and the stomach. These two organs fluid will be overconsumed, becomes dry. Both these two organs hate dryness. When that happens, you are going to nourish the yin and clear the heat. The nourished yin is not the same as you drink water. You drink water, it's superficial, will not go inside, it becomes body fluid in between the cells. You would need medications to nourish the yin and clear the heat. The same disease, measles, but the treatment method would be very different because at the different stage, the syndrome are different. Another one is same treatment for different diseases. If the root is the same, the treatment is the same.
For instance, in Western medicine, prolapse of the stomach, rectum, or uterus are different diseases. However, in traditional Chinese medicine, they belong to the syndrome of sinking of middle qi and can all be treated with the method of supplementing and elevating the middle qi.
In TCM, we think they are the same problem. Both of them are related with the spring qi, or we call it the middle qi, because spring located in the middle. Spring qi, sometimes we call it the middle qi. The spring qi is not sufficient. It's not strong enough. We know that the spring has the function of support. The spring qi goes upward, support each organs to let organs stay in their original place. If the spring qi is not sufficient, they cannot support it, then it going down with the gravity. For those diseases, if there's organs drooping, TCM idea is to strengthening the spring qi. It doesn't matter which organ was drooping. As long as organ drooping is related to the deficiency of spring qi. So you can see different diseases. They are really different diseases, but they use the same treatment. The idea is you're looking for the syndrome. What's the root of the problem and treat accordingly. It doesn't matter the name of it. If you find this video helpful, please give me a like, subscribe to it, and share it with others. See you in my next video. All the best.